conventional world oftentimes underestimates the clinical significance and scope of practice of alternative medicine. Many conventional providers might consider alternative medicine as being herbs or supplements. Some people might be under the impression that the most concerning thing is if a patient forgoes clinical therapy in favor of an alternative therapy. You could think of a diabetic patient or a cancer patient who forgoes chemotherapy or insulin in favor of an alternative regimen. What my article highlights, however, is that the concerns are far more profound. So I'm Dr. Ryan Kessel, and I currently practice at Houston Methodist in Sugar Land. And in the upcoming March 2026 edition of Mayo Clinic Proceedings, you will get to see my article, Risks Associated with Undisclosed Complementary and Alternative Medicine in Clinical Practice. In 2021, the World Health Organization published a comprehensive report listing thousands of different herbal and alternative supplements and described how they can be biologically active. The most famous example would be St. John's wort, which can change the metabolism of other medications. But this is not just limited to one single supplement. Many supplements can either affect the absorption, metabolism, and elimination of other drugs, and this can have be very clinically relevant. In addition, there are other supplements which can affect the lab assays, the most famous example being biotin, which can affect the thyroid and troponin level assays. My article also goes on to discuss the wide scope of practice of alternative medicine. Some conventional physicians might not realize that in many different states, alternative practitioners are licensed to perform physical exams and prescribe medications. In some states, they might be prescribing antibiotics, antifungals, antihelminethics, and even be prescribing chelation therapy. Now, my article is not about whether a person agrees or disagrees with alternative medicine. It's the idea that these treatments are clinically significant and clinically relevant regardless of who is prescribing them. My article then goes on to discuss the reasons why we as physicians might not ask about alternative medicine practices and the reasons why patients might be reluctant to disclose their use. Sometimes it could be because conventional practitioners might have had limited exposure or training about alternative medicine and therefore underestimate its clinical significance. And patients might be reluctant to talk about it because they fear being judged or being belittled by us. For example, if a patient tells a conventional doctor that they believe in energy imbalances or the power of crystals healing someone, sometimes a conventional provider might have a response that shuts down any further communication with the patient. Over time, this can lead to a conditioned silence where patients are fearful or reluctant to even mention their alternative medicine use. Another example, which can illustrate the significance of this, is some alternative patients might believe in the practice of muscle testing, which is where they flex and extend their arm while holding or having near to them different bottles containing different medications. Depending on whether the strength in the arm increases or decreases during the muscle testing will help the patient or the alternative practitioner decide on which medication to take. And this is, once again, not about agreeing or disagreeing with alternative medicine. It is about recognizing the clinical significance of these treatments and therapies. Because if a patient does believe in muscle testing and they are using that to decide either which medication to choose or what dose of a medication to choose. You could picture a patient with uncontrolled diabetes or uncontrolled hypertension. It's relevant for conventional physicians to know whether the patient is going to be believes in, or partakes of muscle testing. It is very important that we approach patients with an open mind. Now, there's no one universal approach that would apply to all patients. Each clinician needs to develop a personalized approach when talking to their patients, and we need to figure out a way that we can encourage open dialogue and open communication with our patients. We need to understand we need to keep in mind what our ultimate goal is. And the goal is not to critique or to belittle a patient, but to encourage open dialogue. Sometimes patients might feel a sense of injustice because, as the famous British philosopher Miranda Fricker described, there's a concept of injustice about whose knowledge is important and whose knowledge is considered relevant. And conventional physicians might value evidence-based medicine and the randomized controlled clinical trial because that is what we've been educated to value. However, a patient might not realize the significance of that, and they might value other things such as their personal or their shared or collective experience. So it is important that when we're talking to patients, they don't feel a sense of injustice, that their knowledge or that their experience is being undermined or undervalued. We also need to have a shared language of communication. Sometimes if a patient is talking about alternative therapies, energy imbalances, cleansing, detoxes, we might not always readily translate that into clinical terms that the conventional physician can appreciate. And so it's important that we are able to find a mutual form of dialogue. We need to remember that our goal is to encourage communication with our patients, because without this, there's a significant blind spot in medicine within the charts. Alternative medicine clinics are actually very popular. Alternative medicine practitioners are licensed to practice in many states. In a couple of other states, they might be unlicensed and unregulated, but they are still able to practice medicine. And a person might be practicing in a city where there are lots of alternative medicine clinics and not even be aware of it. And chances are that if there's lots of alternative medicine clinics near to where one lives, it's possible that some of the patients that we see in clinic or in the hospital might be going to those alternative clinics. If a patient is taking herbs or supplements, which are not biologically inert substances, these are substances which can have real physiologic effects on the patient's body. It can either mask or mimic symptoms, which is something clinically relevant and something which we need to know about. Or if a patient is going to an alternative practitioner who might be prescribing antibiotics or antifungals or chelation therapy, to name but a few, this is clinically relevant information, and it is important that we make it more routine to talk to our patients about their alternative medicine use. In the same way that it is common for us to obtain a social history and a family history on all our patients. So in conclusion, I encourage you to read my article, which will be appearing in the March 2026 edition of Mayo Clinic Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.